Mr. Chairman, thank you so much for having us here at Abu Dhabi Global Healthcare Week, the inaugural summit here, focused on the difference between healthcare and health. How are we going to get there?
Health is the responsibility of all, and it's a journey and responsibility of every individual. When we look at the public health, 80% of the outcome of public health come outside the health sector. 80%. 20% of the factor that influence individual health is controlled by the healthcare sector. Then that by itself tells you that today, if you want to impact the health of humanity, you need to go beyond the healthcare sector. Therefore, within Department of Health, we changed our approach and focus. And we looked at not only focusing at the healthcare system by itself, but look at the whole communities, from communities to individual to system to providers, payer, clinical providers, and as well institutions that really contribute to our day-to-day life. When you think about the individual life, I like to break it into four main components. Your me time, which is affect your mental health, your play time, which is basically your physical health, your social time, which have your meal time and family time and basically your engagements, and your spiritual health as well, which is your engagement spiritually. These four components are really what shape the individual health and the well-being of a healthier individual. And a healthier individual contribute to the productivity of a community and the nation. So that's have a big impact on the economy of every nation. Therefore, I see that health is more important than healthcare, and we need, as an institution and system, from policy making to shift the responsibility not only from health institution and clinical provisions to include everybody in this journey. And I believe we should start now. We are blessed to have technologies as a platform to accelerate that transition.
How big a role do you see AI playing in that transition?
I don't want to use the hype of AI that is AI will solve everything. AI is an enablement. And with the maturity of artificial intelligence, I see it will be like the basics of electricity that we experience, the basic of a keyboard. So it will be embedded in every technology that we use, health or other than health going forward. I believe AI will contribute to three factors when it comes to health. Increase the productivity, big time in our institution, and we don't have enough workforce globally. So AI can play a vital part, as well increase the efficiencies and synergy, so repetitive jobs can be done and doctors can put more time into the engagement with their patients rather than writing down the reports or engaging in administration stuff. Third, I believe AI will revolutionize patient experience and individual experience that will take it to the next level. Imagine with a click in an app, you have your health, it can nudge you, it can guide you, and it can help you. So I see it a critical component into transforming not only healthcare, but humanity in general. Like the invention of electricity, like the inventions of the move from regular internet to 2.0.
As usual, the UAE is willing to put its money where its mouth is, and you've signed a number of MOUs during this conference. How do you see the UAE's role going forward?
The UAE has an advantage when it comes to healthcare. The advantage is in our system, we implement, especially Abu Dhabi, we implemented universal health coverage. All of our hospital clinics and pharmacies are connected into one platform, which is called Malafi, and we are the only country. Our size gives us flexibility and scalability, and a great chance to as well implement faster. So that's implemented. So we have all the clinical records, then we have all the financial, and we have the Emirati Genome Program, which will provide all the genetics. Then this amount of data, we are willing to work globally with all the pharmaceutical, life science, healthcare provider to unlock the potential that will have an impact in humanity. When it comes to technology, you will invest a lot first on the first edition of your technology platform. Then you will start to put an improvement to it. You will reach to a level where you will have a skeleton that can be scalable and as well expandable to different countries that cannot afford it. So I see the UAE will be contributing part of their health diplomacy using that angle, will as well work hand in hand with pharmaceutical to unlock new drugs and new therapies that is more personalized to our bodies and to our genetics compositions. One of the information that we always talk about today, that majority of the medicines available is based on the Western populations. With the Emirati Genome Program, we are designing more genetic profile that we can derive from it, a medicine that can have more impact into us. And then we can go to Africa, India, and then you can scale it. I'm a believer that collaboration, co-creation, if it happened well, it can change humanity.
This level of data access is essentially a gold mine, not just in terms of the ability to make profits inevitably, but also, of course, for scientists in a way that we haven't seen before. In your mind, how does this impact the democratization of healthcare?
I will prioritize data from scientific and research rather than profits. The value of the data today, when you unlock it, it will help you create endless opportunities, endless. So profit is one component, but then discoveries, scalability, responsiveness, accuracy, it's much beyond than that. When it comes to data privacy, I'm always asked, what about data privacy? We are not sharing personalized information. You de-anonymize them. So you have only a data which is extracted out from personal health record and have only the information relevant for the stakeholder to get better insights, better therapies, and better responses into individual health. So that is a greater contribution to the global health. And I'm a believer we should collaborate, Africa, Asia, Americas, together to exchange that type of information. Because with that, in today's world, in every country, the UAE has 220 nationalities. When you go to the US, the same thing. We are a nation of many. So therefore, I believe we need to share. And sharing is what will transform human life.
Your ability to combat the COVID-19 pandemic was frankly a lesson for the world. In your mind, globally, are we better prepared for the next pandemic?
In terms of Abu Dhabi, we are ready, but I don't want to take ready as a tool to be complacent. We always need to equip ourselves and be always on our toes and engage with the CDCs of the globe to really understand what's happening. So we will always stay alerted. We will always stay on an urgency mode to have a better responses.
No doubt. And finally, what do you see as the greatest challenge in this shift from healthcare to health?
I believe the greatest challenge is bringing everybody at the same purpose. And seeing that challenge is not the challenge of the institution of health or the healthcare providers. It's a and COVID proved that. We need everybody to come together to find a solution. Do I have a solution today? No. That's why we designed Abu Dhabi Global Healthcare to have a platform where you can bring the healthcare institution, you can bring the life science companies, the academia, the researcher, the philanthropists, the VCs, to really start to think about how can we really increase the health of the humanity. It's not about your age, you need to live longer. It's about living healthier. Today we are living longer, but more in hospital at the end of the life. We need to decrease that and increase healthier life. That will increase productivity and will have a bigger impact on all of our economies.
So quality life.
Quality life, yeah.
Mr. Chairman, thank you so much for having us here at Abu Dhabi Global Health Week.
Thank you.